Urine infections or UTIs, very common health problem that can affect anyone. In this video, we will explore the various factors that can contribute to the development of a urine infection, including bacterial growth, other medical problems. Understanding the causes, very crucial in preventing and treating them effectively. By watching this video, you will gain valuable insight in the world of urine infection, how to reduce your risk, whether you're experiencing symptoms of an infection or simply want to learn more about the topic. This video is for you. So let's dive in and find out what causes urine infections. Hi everyone, Dr. Peter Aziz here. If you've ever experienced that burning sensation when you pee, the constant urge to run to the bathroom, or that deep pelvic discomfort that just won't quit, you know exactly what I'm talking about. Urine infections or UTI. They affect millions of people every single year. So if you're someone who deals with them over and over again, you're probably wondering, why does this keep happening to me? Today, we're going to break down exactly what causes UTIs, not just the surface level explanations you might have heard before, but the real science behind why these infections occur, why some people are more prone to them than others, and what's actually happening inside of your body when a UTI strikes. All right, so what is a UTI? Let's start with the basics. A UTI is simply a urinary tract infection, which is an infection that happens in the urinary system. That includes your kidneys, your bladder, your urethra. Most of the UTIs, they involve the lower tract, means the bladder and the urethra. Here's what's happening. Bacteria, usually from your own body, they make your way into the urinary tract where they don't belong. Then they multiply. The body recognizes these bacteria as invaders and start developing an immune response and inflammation, causing all of those miserable symptoms and experience. So what are those? Burning sensation, urgency, frequency. Sometimes you even see blood in the urine. It's just not annoyances. That's your body alarm system telling you that something is wrong. So what is the primary cause? It's bacteria, specifically E. coli. These are the main villains in the story, okay? This bacteria is responsible for about 80% of all UTIs. Here's what surprises people the most. E. coli isn't some foreign bacteria from the outside world. It's actually normal bacteria inside of your intestines, all right? It lives in your colon and in that environment. It's perfectly harmless. It's even helpful for digestion. The problem occurs when E. coli travels from where it belongs, meaning in your rectum, to where it does not belong, which is your bladder and your urethra. This is more common in women because of the female anatomy. The journey in the female is very easy to make because the female urethra is a lot shorter than men. In the females, the urethra is only 4 centimeters long compared to about 20 centimeters in men. That shorter distance means the bacteria have a much easier path to the bladder. Plus, in women, the urethra is located very close to both the vagina and the anus. This proximity is the main anatomical reason why women get UTIs far more frequently than men. All right, let's talk about one of the most common triggers for UTIs, which is sexual activity. This is something I discuss with my patients every single day. So, sexual intercourse can introduce bacteria into the urethra. The mechanical action of having sex can push the bacteria from the vagina and the anus up into the urethra and towards the bladder. I had a patient recently, a woman in her 30s. She would get a UTI almost every single time after being intimate with her partner. She was frustrated, embarrassed, and it was affecting her relationship. Once we identified the pattern, implemented some preventive strategies, which we'll talk about later, she was able to break that cycle. All right. That doesn't mean you need to avoid sexual activity. It just means you need to understand the connection so you can take appropriate preventative measures, and that's something we can absolutely manage. The second issue, spermicides or barrier contraceptives. So, spermicides, they can increase the risk of UTIs, especially in women, as they can change the normal bacteria that is living in the vagina. They reduce the number of the good bacteria and increase the colonization of the E. coli that can cause a UTI. I've had several patients, they were using these methods and they were experiencing recurrent UTIs. Once we switched to another contraceptive, infection rate dropped significantly. Again, that doesn't mean these are bad methods or they're wrong. It just means that if you're prone to UTIs, you might just want to discuss other contraceptive options with your healthcare provider. All right, third thing, holding your urine too long. Here's something that many people don't realize. Not fully emptying your bladder or waiting too long can set you up for infections. Why is that? When the urine stays in your bladder for too long, it can create an environment where bacteria can multiply. Your bladder is designed to fill and empty completely. So when emptied, it flushes out all the bacteria that might have made their way inside. I know life gets busy, you're in a meeting, you're stuck in traffic, you're in the middle of a project, you don't want to break your concentration. But your bladder is sending you signals for a reason. Regular urination can flush out the bacteria before they have a chance to multiply and cause an infection. Right? So it is essential for you to try to void every 3 to 4 hours, okay? You don't have to go every hour, but also don't wait for 6, 7, or 8 hours. That's a very long stretch. All right, fourth thing is hydration. Proper hydration, one of the simplest, yet most powerful tools for preventing UTIs. When you're well hydrated, you produce more urine. And that increase in urine helps you flush out the bacteria out of your urinary tract. When you're dehydrated, urine becomes concentrated, which can irritate the bladder lining. All of this irritation makes it easier for the bacteria to stick to the wall of the bladder and cause an infection. I generally tell my patients drink enough water so that the urine is pale yellow. If it's dark yellow, you need more fluids. If it's completely clear all the time, you might be drinking a little bit too much, okay? Most patients means drinking about 6 to 8 glasses of water per day. More if you're exercising, of course, because you're sweating. Also, if it's hot outside or if you're doing activities, definitely drink more water. Now I need to talk about hormonal changes and menopause in women. This is a huge factor that often gets overlooked. After menopause, estrogen hormone declines. So what does that cause? It causes the tissue of the urinary tract and the vagina to undergo changes. Estrogen helps maintain the health of that area. So when the estrogen drops, the tissue becomes really thin, the good bacteria starts dropping and the bad bacteria starts growing up. So there's more harmful bacteria than good bacteria in the vagina. So when the estrogen level drops, the vagina becomes dry, more flagell. This is called genitourinary syndrome of menopause, all right? So the protective lactobacilli decreases and the E. coli can colonize and cause more problems. I have many postmenopausal patients. They didn't have UTIs when they were young, but suddenly they started getting them frequently after menopause. This hormonal factor is a major contribution. The good news is there is an effective treatment, which is estrogen cream that you apply in the vagina. This can restore healthy tissue and significantly reduce UTI frequency by at least 50%. All right, there are some other structural issues that can cause women to have more UTIs, all right? Mostly because of the anatomy and structural issues within the urinary tract. Something like prolapse, where the uterus, the vagina, or the bladder, they can drop down from their normal position. That causes situations where the bladder doesn't empty completely. That incomplete emptying is a risk factor for UTIs. There are some other bladder abnormalities, some structural variations that can cause infections. Bladder stones, kidney stones can also be a source of infection. This is why a comprehensive evaluation is important for anyone with recurrent UTIs. Sometimes the answer isn't just the bacteria, sometimes it's the function or the structure of the urinary tract itself. All right, now let's talk about personal hygiene, all right? Because there's a lot of misinformation out there and I want to set the record straight. So first, for women, wiping technique matters. Always wipe front to back, never back to front. This prevents the bacteria from the anal areas from spreading towards the urethra. This is basic, but it's very important, okay? Second thing, avoid prolonged exposure to moisture. If you're sitting in wet bathing suits or sweaty workout clothes, it can create a warm and moist environment that bacteria love. So try to change out of these as soon as you can. Third, be careful of what you put near your genital area. Heavy perfumed soaps or douches or sprays, they can disrupt the natural balance of bacteria and pH in the vagina. Your body has its own cleaning system. Don't over-clean or use harsh products. And finally, make sure you're urinating after sexual activity because this helps flush out any bacteria that have been introduced during intercourse. So there are some other underlying medical conditions that can increase your risk of developing UTIs. Diabetes is a major one, especially if it's not well controlled, because the sugar is too high in your blood that spills in the urine, and bacteria loves sugar. Alright, so additionally, diabetes can also impair your immune system, making it harder for your body to fight infections. Also, other conditions that can affect your immune system, like autoimmune disorders, HIV, certain medications, they make you more susceptible to other types of infections, including UTI. If you have any of these conditions, you're experiencing recurrent UTIs, it is essential to work with your healthcare provider to manage both the underlying condition and the infections. So there you have it, the real causes of urinary tract infections. It's not just about bacteria randomly showing up, it's about anatomy, hormones, behavior, hydration, underlying conditions, and sometimes plain genetics. Understanding what causes UTIs is the first step towards preventing them. And that's what we're going to focus on in upcoming videos. Evidence-based strategies to prevent UTIs and breaking the cycle. If you're someone who deals with UTIs, I want you to know that you don't have to just accept this. There are solutions, there are strategies, and there is a path forward. If you find this video helpful, please give it a thumbs up, subscribe to my channel. I'm here to provide you with evidence-based information about pelvic health, presented in a way that is clear, direct, and actionable. Drop a comment below, let me know. Have you struggled with recurrent UTIs? What is your biggest challenge? I read every comment. Your experiences help guide the content that I create for this channel. Thanks for watching. I'm Dr. Peter Aziz, and I'll see you in the next video.